a presentation where we're kind of going to get top heavy in information. I want to really bring it back to the spirit of the Tao, the spirit of the medicine, and remain rooted in, I have such a, and probably most of you on this webinar um, have a very sacred relationship with Chinese medicine. Why we came into Chinese medicine in the first place. It was not so that we could become masters of lab analysis. It's we came into this divine healing tradition because we saw or recognized in some way how it was a balm for the soul that soothed the wounds that Western medicine couldn't touch. Um, so my intention is to remain rooted in the elegant simplicity of nature's patterns as they express themselves through the individual, and that we don't lose ourselves in the material as we start going through a lot of material. So um, the the course is broken down into an introduction, which I'm starting right now. Then we're going to go into um, these different panels. We're going to go through a hematologic panel, and we're going to go through the metabolic panel, the electrolyte panel, the endocrine panel, and the organ marker panels. And these panels that you will see in Western laboratory analysis, I want to remain consistent to those. But I also want to root all of those in our understanding. So I'm going to, not in attempt to be insulting, but in attempt to really remain true to who we are and what we're doing. I want to root in some basic physiology when we go into any of these panels. Because as we will begin to see, and this is one of the confusions, and actually this is one of the criticisms that I've had about those that start learning biomedicine. I actually have taught for some doctoral programs, and I've started to see that when these doctoral programs start adding biomedical information to them, they give the practitioner a head full of Western knowledge, a head full of traditional Chinese medicine knowledge, and they don't know what to do with it. And it seems like it has watered down the profession. It has made us weaker rather than stronger. And so I was actually arguing this point once with Jeffrey Yuan. And a little while later, I was invited to teach this particular class for the Taoist Traditions College of Chinese Medicine. And so I had to kind of take that challenge and how would I do this, remaining consistent to our medicine? Because here we're crossing paradigms. And the paradigm of biomedicine is very not only branch level, I call it evaluating and analyzing the individual veins in the leaves of the tree. While we neglect the trunk, we neglect the roots, and we neglect the forest in which the tree grows. So I don't want to get lost in that. So I want to remind you all that the blood, which we are analyzing today, follows the qi. The qi follows the xin follows the Tao, and the Tao follows itself. And so just kind of get out of the, what am I going to do with this information? What is this? We're going to see very few equal signs today. We're not going to look at uh, a red blood cell and say, okay, that obviously means blood. It doesn't obviously mean blood. We have to look at Chinese medical physiology to understand what it really means. Oop. I'm trying to advance the slide here. Let me see if, okay. So a little bit of background, where does this information come from? Most of the information comes from what I've had to do since I started learning Chinese medicine. Since I already had a background in understanding Western medicine, I had to make the two meet. And because I loved Chinese medicine so much, it was like I was instructed when I first got into Chinese medical school that first you must forget everything that you've ever learned about Western medicine in order to learn this medicine. And that was a real challenge for me at that time. But I tried to do that. I tried to, because my own biases really got in the way of me learning this medicine. So that's first where I'm going to come from. Jeffrey Yuen, who has been my teacher for a lot of years, has done a lot of work on Chinese medicine physiology, and he has rooted it in the Tao. And so a lot of the information that I will be presenting today comes directly from him. I hope I don't do him a disservice. And, Taoist Traditions College of Chinese Medicinal Arts in Asheville, North Carolina is where I presently teach for their doctoral program. And this is one of the classes that I teach there. Couple other resources here. The one in the center, TCM Guide Pathology, is by Claire Pyers, who is a wonderful Australian acupuncturist, who in this textbook, she provides a biomedical view of lab analysis, a functional medicine view of lab analysis, followed by a Chinese medical view. So she has these three components in her textbook, if you're interested in that. There's also integrated traditional Chinese medicine and Western medicine in the correspondences of Dr. Li Chenyu and Dr. Juno Yang, his student. And these are case histories, and these are case histories of some pretty severe and difficult, challenging cases that use different biomedical markers. And so they're broken down into cancers, vascular disorders, head and neck, and autoimmune disorders. So kind of heavy on cancers and things. So these are just resources I want to point out to you because we don't have a lot of resources in this. So everybody that is doing this work right now is we don't have a lot to fall back on. We don't fall back on what's been written in the classics because it wasn't written in the classics. This is where we're crossing paradigms here. And so I want to make sure that we remain very strong in our Chinese view before we take it further. So here, just kind of a challenge that Western medicine looks through the lens of pathology. And if we're looking through the lens of pathology, we have a mindset of what's wrong. And this mindset of what's wrong can, because it's fear-based, and we know how fear works as a motivator, it tends to trump looking for what's right. looking for what's working. And so I want that to really be something that we're aware of, that as we go through these what's wrong flags in our blood work, if we let that become the truth for us, we are not rooted in the Tao, we are not rooted in Shin, we are not rooted in Qi, we are rooted in blood. And we're saying, to me, blood comes first. Pathology comes first. And this is where we as a profession tend to get weak, that we let biomedicine become the truth and we default to it. We hear information from the doctor. My doctor says I have this cancer marker or this is what, and we tend to get weak. That's my criticism here. So as we're integrating these two paradigms through one energetic lens, it's important to be able to speak the language of and understand the language of Western medicine so that we can communicate with other doctors, that we can communicate well with our patients, that we can understand terms such as within normal limits, that we don't have just two languages where we're learning about all of the pathology, or we speak in terms of qi and yin and yang, and we lose our credibility in the Western profession. So this idea of within normal limits, this is something that we're going to see when we're looking at these labs. Within normal limits, if you fall within these normal limits, it doesn't flag for any pathology. And yet it doesn't mean that there isn't anything wrong. Because as we know, and as hopefully we were taught in Chinese medicine, that Chinese medicine is more challenging to practice than Western medicine, because we have to ascertain imbalances before they become lab abnormalities, not after. We have to remain stronger in our diagnostic parameters. We have to remain patient-centered and keep the patient first, so we don't lose our inherent strength. We remain true to the individuals who come to Chinese medicine. The individuals who I work with that come to me for help do not come to me because I'm such a whiz at Western medicine. They come to me because I really understand how to work with energetics, how to remain rooted in Shen myself, so that I can start to identify and help them to see where their own imbalances lie before they become pathologic abnormalities. So when we're going over labs, they don't ever take the place of what the Chinese medical pattern is. So even if the lab says one thing, if you're picking up something else, do not let the lab trump your pattern diagnosis. If you don't have a strong grasp of Chinese medical diagnoses, please don't let yourself get lost in the data. And this is what I've learned through trial and error, that I let the labs trump what I was picking up, and I was wrong every time. I was wrong every time. While that might have been a manifestation, I had to go to the root in order to affect a cure. So kind of the challenge that I like to bring up is what constitutes for you real and effective medicine. And what are you loyal to? Are you personally in your own life? Do you go to your Western practitioner, and if they pick up an abnormality, does that become stronger for you than your own medicine is at rectification? And so this is a challenge that Jeffrey asked a class that I was in at one point, and it challenged me to the core. It really did, because it's like, yeah, if something's really wrong, I'm going to resort to Western medicine. And there's no judgment here. This is an individual question. The levels within normal limits change based on a lot of different aspects. Labs changed based on a lot of different aspects. They change based on lifestyle, diet, the stress of the moment, the collection time, what we had been doing that day, how much sleep we had. So a lot of those factors are applicable. And we'll hopefully get to some of those as we go along. But if we come back to our deepest understanding of what Chinese medicine is about, if we understand, or if we go back to what the Neijing says, that all imbalances arise, or all states of disease arise when we lose harmony with nature. And when we lose harmony with nature, not only, the cycles and the seasons and the environment, but when we lose the truth within our own heart, that's where we start to break down. And so if we look at the truth within our own heart, how am I being true to that? How am I being consistent to that? And if we are unhappy in any aspect of our lives, that must be corrected before the pathology can be corrected. So if we're not addressing the source of the unhappiness or the source of the state of disease, we are not truly practicing Chinese medicine. So true patient signs and symptoms, tongue and pulse findings have to remain first. We don't treat the labs, we treat the patients. If we treat labs, it makes us weaker. So I think I've belabored that enough. And by the way, I want you to know that as we go through this material, I'm going to build upon sections. And I'm going to try to remain consistent to what each particular section is based more strongly upon. So if you have questions, if you can, wait till the end of the particular panel, that would be great. Some of the answers may come later in the presentation, and I will defer to that if that's the case. But if there's something that's really unclear, please put it in the chat box. And then remember, I tell all students that take my classes, if the class is being recorded, I ask you not to have me repeat myself so that you can keep up with your writing. Come back to the recording to do that. So, all right, I kind of had to do that all for myself as well. So we're going to begin by talking about the